In this episode, we're going to talk a little bit about exposure therapy, what that looks like, and other ways that people are finding effective treatment that is evidence-based. As anxiety specialists, that's really important to us, and we want to help you along the way too. We're also going to talk a little bit about when it might be time to engage medical professionals.
Welcome back to Raising Resilience, 25 tips for parenting your child with anxiety or OCD. I'm Dr. Josh Spitownik. I'm the practice owner of Anxiety Specialists of Atlanta. I'm a licensed psychologist, board certified in cognitive behavioral therapy, and I have with me my colleague, Marty Munford, licensed professional counselor, and my co-author to Raising Resilience.
So in this episode, we're going to talk about what the evidence-based treatment for anxiety often looks like, and also ways or times where it might be important to involve your medical team.
So Marty, when parents come into treatment for an 8, 9, 10, 11-year-old or for a 15, 16, 17-year-old, treatment can often look very different. We'd always recommend that someone get seen specifically by a pediatric specialist if they're working with someone under the age of 13, but we always recommend someone is seen by an anxiety specialist. We are anxiety specialists. The group we work with is Anxiety Specialists of Atlanta. We see people in 32 plus states, have people living in 3 different states, but being an anxiety specialist and treating anxiety and OCD typically means certain things about the kind of treatments that you choose.
Sure.
Anxiety specialists follow the evidence. We would call ourselves evidence-based practitioners, whether we're doing the assessment and diagnosis of a problem area or the actual treatment planning and offering treatments. It's following the science and what the literature says about the most effective ways to treat anxiety and OCD.
Regardless of which evidence-based intervention you're working from, that information is relevant across the board. And so there's a lot of different ways to approaching the same problem, but it all comes down to doing the thing that's scary. And so oftentimes, one of the things that we hear from parents a lot of is this safe, right? There's a lot of concern about safety, especially when you're talking about exposure therapy, right? When people hear the concept of exposure, they think they're going to be covered in spiders. That's only happened a couple times.
Yeah, they
right?
might be. Let's not dismiss that yet.
So one thing to note is that we are only targeting things that are scary but safe, right? Remember back to our previous videos. We are looking for things that feel scary but they're safe. So take something like spiders, snakes, heights. There is some danger there. There could be some danger there, right? But the fear is not about that danger. It's about how much am I able to tolerate the risk or the uncertainty, right?
And we would never introduce danger into an exposure scenario. So, it's normal to walk in the park. There's plenty of parks around here where there might be snakes, lizards. You go around any trash can where there's been popsicles, I guarantee you, in Georgia, yellow jackets are pervasive. And that's not what exposure therapy is specifically, but it is about facing fears head on and doing things that don't bring any additional danger or unexpected, risks to your life.
Yeah, and so remember, our goal is not to do anything dangerous. Our goal is to do only things that are scary but safe. So take that snake example, right? Snake handling, not what we do,
Nope.
right? But should someone be able to go outside knowing that we have snakes here in Georgia, for example? Yes. Should someone be able to see a picture of a snake or a video of a snake? Yes. Should someone be able to hear a story? Absolutely. So we want to make sure, again, we're working with what are we aiming for and how do we expose people to the uncertainty that comes with that fear, right? And so exposure therapy is safe, but it is something that should be done with a licensed professional.
So a lot of interventions out there you can learn in classrooms, you can learn through books and media. All of us who are mental health providers get trained in very unique and special ways, but exposure therapy is one of those real, what I would describe as almost surgical interventions that requires even a higher level of skill and training. It's why a lot of everyday therapists don't do exposure therapy, and it's why some anxiety therapists actually don't even do exposure therapy. Having shared that exposure therapy is not the only proven intervention out there for treating anxiety and OCD. It's just one of the most researched and proven in the literature. And exposure therapy for OCD is called exposure and response prevention. With all the other anxiety disorders, it's some version of exposure therapy.
So the short answer for parents is, yes, it's safe, but we do recommend that you work with someone who is highly trained. This is a specialist skill, and therapists, psychologists don't necessarily come out of grad school having learned this.
So that's an important piece to recognize, that when you said therapist and psychologist, those are different credentials and titles, but in our field as anxiety specialists and on our team, she's a therapist, but she's a licensed professional counselor. I'm a psychologist, I have a doctorate, but in our space, the credentials don't matter. And I want parents to hear that, which is when you're looking for a therapist for your family, which is, we know, not easy to find no matter where you are, that though credentials do matter, and having a licensed mental health professional in your life does matter, that when we talk about anxiety specialists, whether you're doing an intervention called exposure therapy or other interventions that are highly effective like acceptance and commitment therapy, more cognitive interventions like metacognitive therapies, these are all leading interventions to help someone overcome and battle anxiety. You want to make sure that that person is trained in those interventions. And whether someone's a counselor or a psychologist, I know plenty of psychologists that don't know any of the things we're talking about. And I know plenty of master's level licensed mental health professionals, which is the category Marty falls into, that dance circles around psychologists. So when you start getting into specialties, I want parents to pay a little bit less attention to the credential, but you can go on a website and see what organizations they're a member of, what trainings they've had, what language they use. If the website says, learn how to breathe and relax and do mindfulness to not deal with your anxiety, I'm not recommending my families and kids to go there. And if the website says that they've been trained by certain organizations like the International OCD Foundation or cognitive behavioral therapy organizations, they know stuff about exposure therapy, cognitive behavioral therapy, ACT, evidence-based interventions, those are typically the kind of clinics we're going to recommend.
And so the other piece to this, if we get into tip number 22, is that there are times where you might be looking at a medical treatment for the anxiety. Obviously, those are refer out situations for us. We're not medical doctors, but when a good sign for me is if someone has really overnight presentation of anxiety and OCD symptoms, we definitely want to go and make sure that they get some help from a medical team if it's needed. If they get cleared and it's just back to us, then great, we'll run with that, but it's better to check those things out and make sure we've got the whole team assembled before we get started.
And there are some good resources out there regarding some of the things that you were alluding to. And if you go to the International OCD Foundation website, and we'll put the link down below the video, there are some good resources about medications you might consider for your child if you're advocating for them to go see a psychiatrist. And we do strongly recommend you see a psychiatrist, not just a pediatrician, for your child who might need medication, and other medical conditions that some people will talk about, like something called PANDAS or PANS. And the International OCD Foundation has some wonderful resources on their website that I recommend you take a look at and research when you think, as you alluded to, that someone's presentation, someone's struggles went from day one nothing to day two something. That can look very scary, and sometimes that could actually be the presence of a medical condition. But we're often working with medical providers, working with nurses, we're working with gastroenterologists for kids that have tummy issues who are worried about throwing up, working with school professionals, but we're often working with primary care doctors, pediatricians, and psychiatrists. So we are not medical providers by trade, but we do work and collaborate with medical providers. If your child has a condition that either needs an evaluation or they would benefit from medication therapy, which is always a tough discussion with every family to have. But in my space, when a child's anxiety is so frequent and or so severe that it's completely impairing their ability to function and maybe even making it impossible to benefit from the kind of therapy we do, that's usually pretty good indication for me to consider medication. And every parent has their own threshold of whether they want medication for the children, and that's a parent by parent decision, and we respect that. But if your child had diabetes, we would seek out medication options. And if your child's struggling with psychiatric chemical imbalances that are so severe, we would at least recommend you at least consider getting a medication consult.
So I hope you enjoyed this episode, learning a little bit more about exposure therapy and evidence-based treatments for anxiety and OCD, both on the therapy side and the medical side.
Absolutely.
Follow along. We've got just a few videos left, and we look forward to seeing you at the next one. If you like this episode, feel free to like and subscribe so you can keep up to date with everything else that we put out on our channel.
Which is, I didn't want to meet you, but I can't wait to see you when we're done. Or, man, it really sucks. And so a lot of people will learn exposure therapy in therapy. That sounded funny. And then go do it on their own because they've been taught and trained how to do so.
Okay, I'm afraid of snakes. Where's the pit of snakes? And it's out back. Just kidding.
In the dumpster, by the way.